Hi, my name is Melina Hall, and this is my video journal reflection for my PEDS clinical. So, bedside shift report. I didn't get to see it too often because a lot of times for clinical, we would come in, our instructor would give us our assignment, and we would sit in a circle and talk about each patient and like read what was going on with them so that we could discuss it further, especially if we had like an exam that week that had to do with, one of our patient's diagnoses or something. But I did get to see bedside shift report a few times, and a lot of the patients on our floor were like, I don't know if saying chronic patients is the correct word, but they'd been there for a while. So a lot of the nurses were already familiar with their patients that they were assigned. And so a lot of times they would just get like a short rundown of report, and it would basically just be like, what's new with this patient, like what happened overnight or what happened over the last 48 hours since I last had them. But when they weren't getting a patient that they knew before, it was a very thorough shift report. And of course they went in to meet the kid, their patient. The family-centered physician rounds, I thought it was really great. I think that that's something that you don't see very often in like adult hospital care. I mean, yeah, sure, the doctors come around and see them, but just the way the doctors interacted with the patients and like talked to the families and stuff, I think it was very good, very thorough. And of course, they interacted with the child, depending on their age, the same way that they would if they were seeing them, 12 hours a day, every day, the way like the nurses do. So I thought it was really great. The way the nurses organize their days, I have no idea how they manage it, but it seemed like they never sat. And they just like kept having things to do. But of course, morning meds and assessing their patients, and greeting their patients. And if they need something or, give them toys, keep them occupied, stuff like that. It seemed like they had like very thorough plans for the day. And I think, I'm not sure if it's because it's PEDS, it just makes it so much more busy, but I feel like they have to organize their day very specifically because it seemed like they had a lot to do a lot of the time. The medication administration process, all the meds that I saw were either given through a central line or like an NG tube. So it was never like a kid that had to like was given a suspension or anything oral or any shots, like, whether it's sub-Q, IM. I didn't see anything like that. Most of the time, especially with the patients I had, when the nurse was giving meds, like either through a central line or through their tube, they weren't even really paying attention. They didn't really care all that much. And that might be because they're used to it. But of course the nurse, still said like, oh, I'm here to give you your meds. And, still playing with them and talking to them while they're doing it. But a lot of times it seemed like the kids they didn't really care that much anyway. But the nurse still like, made sure to like interact with them while they did it. The nurses carrying out their assessment, again, because during the morning we like went over all the patients that we had as a group and like talking about their diagnoses more and stuff. I didn't get to see a ton of their assessments either, but I did see a few. But the way that they like interacted with their patients, developing, sorry, depending on like their age, like obviously if you're taking care of an infant, you're just looking at them and talking to them and stuff, even if they can't understand you, like when they're assessing them. Or if it's like a toddler, they would talk to them and the toddler would talk back, they'd have conversation. And they would like, if they were trying to listen to their heart or their lungs and like they went for the stethoscope, they would let them like look at it and, ask them, oh, do you want to listen? And so like they really interacted to make it as normal and as comfortable of a process assessing them as it could be for the patient. I didn't get to see any special procedures, unfortunately. I think that would have been really cool though, but I just didn't get a chance to because of the patient assignments that I got. Two things that I really liked about the nursing care is how super engaged all the nurses were and all the doctors were with their patients. There were a lot of times nurses that weren't even assigned, like maybe say the patient that I had, if they're going past the room, they'll still say hi to them because they know them and, like they still interact with them. And so I think it was just that everyone's just super engaged in caring for all these patients, whether they're assigned to them or not. and just the care that they give is so thorough, and they really try to make this as normal of an experience as they can, given that they're, it's a child in a hospital. The second thing I would say is that all these nurses were so busy. I never saw them sit, but they were so methodical in their planning and the way that they got stuff done. And it didn't seem like they were like stressed out or like running around like crazy. It's just that they had a plan of what to do despite how busy they were. I wouldn't say that there's anything that I would have recommended to like be done differently or that I wish would have been done differently. And then growth and development being taken into consideration. Like I've said before, the way that they talked to the patients, the way they interacted with them, the way that they assessed them, giving them their meds, they always took their growth and development into consideration in order to, give them the best care possible. So the patient that I did my developmental assessment on, sweet little girl, 2 years old. She was absolutely adorable, loved her. But she was somewhat developmentally delayed. And I believe she may or may not have been on the spectrum, but I believe she was too young to be formally diagnosed. So, we just said she's developmentally delayed. So for gross motor for a 2-year-old, they should be able to catch themselves when they fall. Their gait may be unsteady at times, but they should be able to like catch themselves, and they should still be able to like jump and run. For my patient, she only started walking, a few months prior to her being 2 years old. So she was able to walk, and it was very unsteady. I had to watch her as she was walking to make sure she didn't fall, because if she did fall, she wasn't gonna like be coordinated enough to catch herself. So she was somewhat developmentally delayed in that. She was able to like bounce up and down. She couldn't jump, but she was able to bounce up and down. She did that a lot. She liked to dance, and she threw things a lot. She couldn't catch. We tried, but she threw things a lot. Her toys. So she was developmentally on track for that. Her fine motor skills. So as a 2-year-old, she should have been able to hold utensils with some control, but with smaller or like more detailed things like zipping something or buttoning something, obviously a 2-year-old would need help. Developmentally for fine motor, I believe that she's on track because she was able to hold toys no problem. And like I said, she was able to throw things and pick them back up. But as far as like smaller things, besides picking up toys and stuff or like grabbing the bars to the crib, she didn't do much. So I believe she was on track for that. Language, this is where she fell behind a lot. So for a 2-year-old, they should have a lot more receptive language than they do expressive language. So she should be able to understand more than she can talk, but she should be using short sentences and have like a vocabulary of like 50 words. She was severely underdeveloped in this because the only word she could really say was yeah. And that's how she said it, yeah. But she didn't really know what she was saying. She was saying it, but she didn't know that she was telling us yes. So if we would ask her a question and she would say yeah, and then, we would do it or we would give it to her and she would cry, it's because she didn't really mean yeah. She doesn't know what she's saying. And she couldn't really speak in sentences, and that was really it. So she was definitely underdeveloped there. For personal and social, for a 2-year-old, they should have egocentrism. I think I'm saying that right. And I think she fit developmentally for this because she would be at one point happy and then she would throw a tantrum. She just wanted what she wanted. And so I think that was normal. She just wanted to please herself, which is normal for a 2-year-old. And then for response to illness and hospitalization, it's normal for any child, especially a toddler, to regress. And this could be the cause behind some of her, delays. Like it could be exaggerated because of her regression. But for the most part, she seemed happy and content within the hospital. And I think that's just because of the way the nurses and the doctors and the PCTs and everyone there tries to make it a normal environment, as normal as possible. And so I think that's why she seemed happy, but definitely, I definitely think that she has some form of regression. She also, needed consoled sometimes. Sometimes she just wanted to be held. And I think that's normal considering that she's in a hospital. I didn't see any separation anxiety in terms of, being hospitalized, but I never did meet her parents or see her, like taken away from them or anything. So I didn't see anything of that nature. But overall, I really enjoyed Peds Clinical. I think it was one of my favorite clinicals. I learned so much and I would totally do it again. Thank you.